Hello, my name is Jessica Bryan, and this is my presentation on quantitative versus qualitative approaches to nursing research. Nursing research can be described or defined as a systematic process that relies on disciplined methods to answer questions or solve problems. Research allows the nurses to generate evidence about issues pertaining to the nursing profession, add to current knowledge, and thus improve overall practice, including areas of education, administration, and informatics. There are two types of research, quantitative and qualitative. It is important for the researcher to determine the type of research to be conducted according to the nature or problem that is being studied, and the question in which she hopes to answer and address. Qualitative research is the most purposeful when addressing a research problem or phenomenon of which there is little understanding and can potentially form a hypothesis. Qualitative data are narrative and subjective, expressed in words, and can present in the form of observations, images, interviews, and words. Qualitative research also does not require a big number of participants. It can be a convenient sample using purposive sampling and is meant to be kept small in order to provide a more inclusive study of the participants that are involved. The data collected is done via observations, interviews, surveys, and mostly conducted in the field. Data analysis consists of an organized process to transcribe, code, and perform a content analysis. However, there is not a defined set of rules for analyzing the data, as this method produces a large amount of information. Raskin et al. 2018 highlight the importance of data analysis in qualitative research and report that the extensive and rigorous examination of the data can enlighten the intricacy of human behavior, produce interventions, and give voice to those who have lived through those experiences. Quantitative research is primarily beneficial for answering a research question and or testing theories and hypotheses. Numerical data is collected through instruments or tools such as surveys, polls, and questionnaires, as well as rating scales. The data is then analyzed for trends and variables and compared using statistical analyses. Quantitative research requires a larger number of participants. It also determines reliability and validity of the data in order to determine if it can be replicated and determine the level of accuracy. Qualitative research consists of multiple methods. Ethnography, phenomenology, and grounded theory are the predominant methods, in addition to narrative, descriptive, and case studies. From the perspective of incivility in nursing, with a specific focus of faculty to student incivility, the phenomenological method would be an appropriate approach. Phenomenology is uniquely designed to help health professions education scholars, or HPE scholars, learn from the experiences of others, and it is considered to be well suited for exploring challenging topics in healthcare. Neubauer et al. 2019. Ravitch and Qual, 2021, note that this method seeks to report the participants' experiences and focuses on how they experienced it in order to understand the extent of the impact. Data can be collected through various ways, as previously discussed, and the analysis of data can produce interventions to bring successful changes. Strengths of this method include enabling the researcher to understand better the experience as lived by the person, and more likely to pick up factors that were not part of the original focus. Data collection can be conducted more quickly and can contribute to the development of further research and potential implementation of new theories. Disadvantages and limitations of this method include the amount of time it takes for data analysis, the potential for increased bias, and the subjectivity of the study. In a similar study, Zhu et al. 2019 used a descriptive approach to conduct a systematic review presenting comprehensive summaries of incidences of incivility as perceived during clinical education of nursing students. Over 3,000 studies were originally returned in the search, but only 6 findings actually met the criteria and were included in the analysis. The analysis provided insight and evidence of the experiences of incivility during clinical education. Quantitative research also consists of various methods. Methods include descriptive, correlational, quasi-experimental, and experimental research. For the same topic of incivility as mentioned in the previous slide, with the focus of faculty to student incivility, the descriptive research design using the Nursing Student Perception of Civil and Uncivil Behavior Instrument tool, also known as NSPCUB tool, can be used. This approach would allow the researcher to understand the incidence of the unprofessional behaviors from the student's perspective by providing numerical data that measures those variables. This would help identify characteristics and trends that are associated with the behavior to understand the incidence and support potential changes based on the evidence that has been defined. Some strengths noted in support of descriptive quantitative research includes the larger population sampling, the randomized selections, the use of instruments and tools for measuring, and less time that is spent on completing data analysis due to the use of statistical software. Limitations and disadvantages include the potential for leaving out common meanings of the problem that are being studied, the lack of influence of experiences, and potential bias in the sampling process. In a similar study by Texa et al., student incivility was studied in a clinical setting using clinical adjunct. The NSPCUB tool was used to survey 300 nursing students. The data was used to develop interventions that were specific to the unprofessional behaviors in order to address the phenomenon. After implementation of those interventions, the same tool was administered to 410 students, which resulted in a statistically significant increase for 7 of the 12 survey items, and the tool was determined to be highly reliable. In review, for future research on the question on the incidence of faculty to student incivility in nursing education, I would choose the qualitative method using a phenomenological design because I feel it would be best suitable for my overall goal of my research. The lived experiences of the students enrolled in the junior class of a local BSN program will be used through purposive sampling to hopefully produce the data that will be organized into a matrix or chart. From the organization into a chart, themes will be identified. This will help categorize the research and provide the best information with the overall goal of suggesting data that will support the implementation of interventions as well as potential changes. Hopefully, the research can then be used to bring awareness to and decrease the number of occurrences of uncivil behavior among nursing students and promote the retention of nurses in our career field. And these are my references.